Am I good? Okay. All right, so tendonitis at your knee. Most commonly occurs at your patellar tendon. It can be called jumper's knee. It can also occur at the quad tendon as well. So your quadriceps muscles here, you got 4 quadricep muscles that attach right into this flat area here. That's your quad tendon. And then that quad tendon inserts into your kneecap or your patella. And then from your patella, there runs a tendon that attaches to the lower leg on your tibia, or your tibial tuberosity. And that is called your patellar tendon here. Okay. Sometimes you can get patellar tendonitis. So tendonitis is just acute inflammation. So too much load has been applied to the muscle and tendon. The muscle couldn't support it, so now the tendon is absorbing that force. The tendon says, I can't do this anymore, and it starts to break down. And that's how you get tendonitis. If it happened like a week ago or so, it needs to be rested. Okay, rest, ice, eliminate the activities that bother you, and then it needs to be specifically strengthened, no matter if it's quad tendon or patellar tendonitis. Now, oftentimes, if you're young, if you haven't hit puberty yet, or as you're going through puberty, you can get a little bump here on your tibial tuberosity. It's often called Osgood-Schlatter's disease. And what happens is that bump on your shin bone gets larger. And that's happening because you're growing. So your bones are growing at such an exponential rate, but your muscles and tendons aren't. So what's happening is those tendons where they attach on the bone, they're actually pulling the bone with it as the bone, or I should say the bone is growing away from it and the tendon is holding on to the bone. So you get that little lump there and that hurts. Can be fixed with conservative strategies for sure. Stretching of the quadriceps, stretching of the hamstrings, strengthening of your hips, and then gentle strengthening and return to jumping for the athlete for the quad. So that's just a little bit